I'm Dr. Cheryl McDonald, Willamette Valley Hospice Medical Director. If you or a loved one are facing a terminal illness and are seeking comfort rather than aggressive or curative treatment, we'd like to talk to you about Willamette Valley Hospice. We've been helping people make every day the best day possible for over 40 years. So let's meet our admissions development specialists, Jennifer and Arlene, who will give you some details about how hospice works and the amazing services we provide.
So hospice is the type of care that comes in when somebody has a terminal diagnosis and either they don't want to do any more aggressive treatments or maybe there aren't any aggressive treatments available. So hospice comes in and focuses on comfort, quality of life, and trying to keep people out of the hospital. So it's definitely a different perspective on care than people have received up until this point, because with hospice, we're no longer trying to aggressively prolong life, but we are trying to increase people's quality of life. We are trying to help make them feel better and be able to reach their goals. We're just not going to be treating the underlying causes of what's going on.
The biggest goal of hospice is comfort at home. People are tired of going back and forth to the hospital and the doctors and running all the tests and labs, and they just want to be home with their loved ones doing life things. Hospice is for anybody with a terminal illness of 6 months or less projected diagnosis that either treatment isn't working anymore or they are choosing not to pursue a treatment. And it covers many disease processes. And it's not just for older folks either, it's for anybody that needs assistance.
And they have decided that they don't want to do any more aggressive treatments, that they just want to focus on increasing their quality of life and living the best days possible for as long as possible. The ultimate goal of hospice is to help increase people's quality of life and give them their power back. Oftentimes when people come onto hospice, they've had a lot of things taken from them, and I believe that hospice is an opportunity for people to feel like they have their power back again. They can start to increase their quality of life and spend their energy not necessarily fighting hard and feeling terrible, but feeling great and doing the things that they love.
Some of the goals that people have for hospice is as little pain as possible. Being with family, reaching like a birthday or milestone of an anniversary or something like that.
So if their goal is to walk across the room, we make sure that they have the equipment that they need in the house to be able to do that. If their goal is to play with their grandkids, we do everything that we can to give them the energy to be able to do that again, to manage their pain so that they're able to get down on the ground and play with their grandkids. And if they want to make it to their daughter's wedding, we're able to make that happen as much as possible. So our team dedicates themselves to get to know patients and families to find out what's important to them and how we can make their goals become a reality.
It is so important to know the patient. Everybody's life experiences color how we react and feel, not only emotionally but physically. And the family dynamics are going to add to that. A person is going to have more pain when they're stressed from family who's stressed. So we want to support everybody. We're not only there to do our task, we're there to support the family and make sure they're comfortable and ready for when we do leave after we're done with that task, that they're going to be able to maintain that and feel comfortable with us in the home and giving them that teaching and support and love.
So there are different qualifications for every potential disease that people could be coming on for, but as long as two physicians believe that if the person stops aggressive treatment, they have a life expectancy of 6 months or less, then they would qualify for hospice.
It's always a choice, not a one-time use program, and we have had people for a long time on service or choose to go off as well. So it's a very flexible, fluid program. To get signed up from hospice care, there's many different ways. We get community calls from either the patient or a relative. We've even had a neighbor call and say, you know, my neighbor's really getting ill. I know they have cancer. What can we do? We can contact physicians. We have doctors give us referrals. We have hospitals give us referrals. So pretty much can come from anywhere, and then we can help facilitate getting the steps in place.
So once we either get a phone call from a family member or a referral or from a physician, we try to reach out to the families right away. They should be getting a phone call that day from one of our admissions team staff. and then they try to set up a meeting with myself or one of my coworkers to kind of help explain hospice. We call them their program explanation visits, where we can help explain hospice, answer any questions that they have, so that they can make an educated decision about what they want to do moving forward.
The hospice team has 24/7 on-call nurses. We have our physicians as well. We're not with them 24/7, but we're available by phone. So even 2 o'clock in the morning on Christmas morning, we have people that can manage over the phone, and then all the visits throughout the week of all the different disciplines. Hopefully we can keep them very comfortable and happy. Your core team that you get assigned is a nurse and a social worker. Then you have spiritual counselors who can do many different religions and faiths, home health aides for personal care. We have massage therapy, pet therapy, music therapy, volunteers. We have bereavement support. We have a whole plethora of folks that can be very helpful.
Once somebody has a program explanation and believes that hospice is the direction that they want to go, they meet with one of our admission nurses who does a more thorough kind of evaluation. And at that point, they're able to kind of determine what medications the patient might need, what durable medical equipment, we refer to it as DME, that they might need. And then we try to order everything that can usually be delivered within a couple of hours to kind of get them equipped with everything that they might need moving forward.
We will supply any biologicals like chucks, depends, mouth swabs, creams, wound care, all of that stuff. We supply all of the medicine for diagnosis and comfort. We send a comfort kit, so we have emergency medications in the home in case something happens at 2 in the morning when the pharmacies are closed. We try to manage pain, anxiety, breathing, and everything we can right there at home with medications and massage, positioning, all those different techniques. It's not just about a medicine, it's about a whole team approach.
When patients come onto hospice, it is not uncommon that they've had repeated hospitalizations, repeated trips to the emergency room. The great thing about hospice is that it allows patients and families somebody to call instead of calling 911, even in the middle of the night. We're able to advise over the phone or send a nurse out that can come help manage whatever symptom may be happening so that patients don't have to go back into the hospital, so that they can spend their time and energy with their families at their home instead of having to spend time coming into the hospital and draining all of their energy coming back and forth. Medicare governs hospice. So like anything that Medicare governs, there's kind of rules and regulations that kind of coincide with who qualifies for hospice. So like we talked about before, in order to qualify for hospice, you have to have 2 physicians that think that you have a life expectancy of 6 months or less based on your disease. So there's kind of this baseline qualification. After 90 days of somebody qualifying, then Medicare asks that we do a re-evaluation. It's called a certification period. So as long as the patient continues to meet this baseline kind of qualification, they can stay on hospice indefinitely. So there isn't a time frame for how once you've been on hospice for a year, then you have to come off. As long as you continue to meet that base qualification, you can be on hospice indefinitely.
Some people get better and they aren't medically appropriate. Each disease process has certain deficits that they have to reach in order to be considered terminal. So if they get past that for a certain amount of time, then we aren't legally able to keep them, so they graduate off service. And then if they get ill again, they can come back or have a new disease process.
Hospice is paid for 100% by Medicare. Most insurance companies cover hospice almost 100%. But before patients make the decision to actually come onto hospice, we do a full insurance background check so that they know exactly what their responsibility would be, if any.
And then we also have what's called our philanthropic care, where someone can fill out an application and we can waive part or all of the fees for our services.
It's very simple to come onto hospice. So really, once somebody has agreed that this is kind of their goal and the direction that they want to go, they just have to sign one piece of paper. It's called an election of benefit. It's a Medicare form. We refer to it as an EOB that just basically reiterates hospice philosophy, making sure that this is the direction people want to go. Gives a kind of a breakdown of any kind of financial responsibility that they might have. It lets them choose who they want their attending physician to be, and it's just one signature that it requires. Willamette Valley Hospice has a huge commitment not only to patients, but to families. And what that means is that we understand that patients are going to be dealing with a lot, but so are the families. So we want to be able to support the families throughout the hospice process. And then when somebody passes away, our support does not end. We have a full bereavement department with master level counselors that offer support groups, individual counseling. We actually have a kids camp that we offer in the summer for kids that have lost somebody who's really important. We actually offer our bereavement support to anybody in the community. They don't have to have had a loved one that passed away on our service. This is a commitment that we have to the entire Willamette Valley, so anybody can access our bereavement services.
We follow them for 13 months. We offer phone counseling, in-person counseling, drop-in groups, and it's very, very important to get that aftercare. Nobody knows how it's going to feel until it happens. A little personal information, my mom was on this service 31 years ago, and the bereavement support saved me. It was the most amazing thing to be with people that know what you're going through, that you can talk to, that understand it.
We urge you to reach out to Willamette Valley Hospice if you have any questions. You can schedule a no-cost phone conference, video visit, or one-on-one consultation in your home. We know these are difficult times, and we're taking all necessary precautions to help keep any interactions we have with you safe and comfortable.
A success with hospice care is when we reach back out to the family and they say, "You guys did amazing, my mom was happy and comfortable."